Acromegaly is a quite rare disease that affects both genders in the same proportion, mostly but not exclusively middle-aged people. And its onset is quite insidious, and there is a very long lag time between the onset of symptoms and typically the diagnosis, several years typically. And that's because the symptoms are insidious and because the physical changes that may be apparent at the time of diagnosis happen so slowly that the patient and people who see them on a regular basis often don't notice it. And maybe the patient is noticed to be different in a family reunion when the distant cousin hasn't seen them for several years and tells them you look different. Excessive growth hormone are seen in multiple parts of the body, in the heart, the lungs, the joints, the bones, the glucose metabolism, blood pressure. So if somebody is diagnosed with this disease, it's important that all the specialists that see these patients are involved, they're aware of the diagnosis, and that there should be collaboration among different specialists. Because once, let's say somebody has diabetes and is on insulin, once the acromegaly is controlled, well, they most likely are going to need less insulin, or may not need insulin at all, or their blood pressure medication needs to be reduced in dose or changed or maybe even stopped. So if a cardiologist is managing their high blood pressure, the cardiologist has to be aware that, well, maybe the blood pressure medication is no longer needed or needs to be reduced. So collaboration between different specialists is really paramount in this disease.